Who are you? What's your, really what's your superpower, and why should you win this award?
So SonarMD, we drive better quality of life and outcomes for patients with inflammatory bowel disease. So because not everybody deals with this on a daily basis, this is different than IBS, which is irritable bowel syndrome. This is the overarching title for patients with Crohn's disease and ulcerative colitis, which are really high cost chronic diseases. They cost about 5 to 6 times what the average patient costs, the payer. We deploy a value-based arrangement. We do not disintermediate the patient's relationship with their physician. And I would call that our superpower. And because we do that, we are able to drive about 80% engagement rates with our patients, which drives really significant outcomes because you certainly can't drive behavior change and catch people from deterioration if you can't engage them. So we're really proud of that.
Specific examples of how it's being used by, again, any partners, any hospital systems, anyone who you can talk, give us something specific about how it's impacting care.
So we were founded by a physician who deployed this idea of, we're named after a submarine, pinging patients between visits. And in January of 2020, we had to see whether or not we could take what he did in his practice and deploy that in individual practices that weren't affiliated with him, and do that in partnership with a payer. So we contracted with a payer in 2019 for a value contract that said if our IBD patients cost $40,000 right now and we can come in at $36,000, we'll share in those savings. So it was a full total cost of care contract with that payer. We then, in turn, went to the market and we signed 3 of the largest independent GI practices in the state and signed all of their patients, which was approximately, I think at our height, it was over 2,000 patients that we were managing their inflammatory bowel disease symptoms for. The whole crux of IBD is that it's a chronic disease that deteriorates without warning. So your goal is to stay ahead of it, which means, again, back to our engagement, our superpower, which means you have to really have those practices as your partners in both engaging patients, but also if they deteriorate, escalating them to the right type of care. So really proud. This past spring, we were able to publish a study based on 500 patients of that population that were continuously monitored by us for 2 years. In that case, we lowered ED visits by 45% over a control, and inpatient visits by 78%.